first of all, I shared in the chat the link of the video that Mariana just said about the GRAVITATE-HEALTH use case. So it's for to get to know for you who were the other vendors who participate in the use case of GRAVITATE-HEALTH. So please get on board. As Mariana said, my name is Fransisco Mejia. I'm based in Berlin. I'm the head of the Interoperability Showcase for the European Conference, alongside Cristina Caravaglio and the HE Catalyst, who is our strategic partner in the testing. So I'm gonna talk a little bit more of what is the Interoperability Showcase, what you can expect, and what is the really the objective of this. But I wanted to just come back to some words that Petra and Lene just shared before. One is the importance of cybersecurity in this interoperability landscape, and we have seen several companies going to this engagement. Just to mention one, Palo Alto Networks is now confirmed for the Interoperability Showcase because they see that it's a demanding fact to be compliant in the cybersecurity landscape. And also what Lena said, let's try to translate the testing into a demonstration. I know that there's many difficulties on really making the demonstration, like really putting forward what you have been testing into a real scenario, but the showcase is a safe scenario to demonstrate what you are achieving or what you would like to achieve in the following year. So let's go directly to the engagements on the showcase, but happy to answer any questions as you need. So let's go to the dates. That the European conference is going to take place in Paris, as mentioned. We will have 3 days of exhibition, 3 days of demonstration from the 10th of June to the 12th of June. It's going to be in a really good locations, close to the Arc of the Arc of well. But yeah, it's a good location. The team from HIMSS is myself and Cristina Caravaglio, as mentioned. She's also part of the IHE International Board, and you might know her quite well from our experience. And let's talk about more on what we want to achieve. Like, yeah, we have a specialty pavilion in the show floor where the sponsors will get like an exhibition pod, but also a demonstration stage where they will be connecting with others and demonstrating a storyline. So the point here is to try to demonstrate what happens in reality. So as the previous the speaker said, like in the European health data space, what we would try to achieve is how to mobilize data while the patient is in the middle of everything. So yeah, like in the GRAVITATE-HEALTH use case, for example, we try to move the person from Greece to France, to Greece, to France, and Rome, Italy and Turkey. Why? Because we have different vendors that were part of or like developing their solutions in those countries. So that's what we want to achieve, like how the mobilization of the data is possible, how we can demonstrate that for a bigger audience. And this is exactly what the showcase is all about. Who are welcome for the showcase? Basically, all of you, either if you are coming from a technology provider, even if you are coming from a European project as GRAVITATE-HEALTH, or a non-profit organizations as the IHE Catalyst. Because in essence, what we want to achieve in the interoperability showcase is how all the stakeholders can play in the same field, achieve the same goals, while really delivering care for the patients. Last year in Rome, we had 2 use cases. One was more concentrating the Italian ecosystem. We were floating data between 2 regions, and the other one was the one in which GRAVITATE-HEALTH was part of. We were mobilizing basically data across the different European states. Here, as you can see, different vendors that were part of that, but also some of the government bodies that were part of the use case in the Italian. So we have ARIA or ESPA, that it was kind of a part of the Lombardia government in Italy, and we were like, yeah, achieving with them some different maturity of the digitalizations into Italian regions, with a good number of stakeholders like Dedalus, Engineering, GPI, Healthy Reply, Intersystems, TIGA, which is a Turkish company, Tortoise, a UK one, and Zebra Technologies. In the use case of GRAVITATE-HEALTH, we had Nomonon, one of the Greek partners that is a long-lasting partner for us, 2 times in a row demonstrating Dedalus, TIGA, and Zebra Technologies. And as I said, I put the video here so you can have a look on how this use case looked like. We have two different ways to be part of the showcase. One is what we call the curated use case, or the other one is the standalone. The curated use case is like something that is already happening, or maybe something that you already tested with your partners and you wanted to put forward that message all together. So you know your partners, you know the message, and you put it on the showcase. The other one that we have is the standalone, or what I call the standalone, is what GRAVITATE-HEALTH was part of. We create an EPS, we mock an EPS, we create a patient, we create a history in which this history allows all the systems to be connected and make a seamless integration of all of the softwares. What is the value of this? Is one, showcasing that interoperability is possible, it's possible in reality, not in the books, but also it's easy and seamless. I know that this might look easily, but what we do with the team is to start connecting the systems before the conference. Otherwise, this would not be possible. So it's a joint venture that we are doing with the IHE Catalyst. We have different calls before the event to make this diagram possible, to make the connections possible, and to then deliver what is needed on the flow plan. The benefits, I'm not going to waste much time here. If you have, or anyone has any questions, my data is in the last slide. But I wanted to, this is the flow plan for the Paris event that is upcoming in June. There are 2 major touch points where the showcase is happening. One, in this pavilion, which is the Interoperability Showcase Pavilion. As you can see, each organization will have their own pod for having their branding, their different exposure. But what we want to have is in here, we will have the stage where the demonstrations will take place. We will try to have at least 1 or 2 demonstrations per day, 1 in the day number 1 or the day 10, and 2 in the day 11, and 2 in the day 12. That's what is being planned, but of course it will depends on the vendors, on the participations, and the willingness to do this. Also, that's important to mention. We leave some speaking opportunities for the participants in the tech leadership stage, where we don't want to replicate what has been demonstrated in the tech stage, in the Interop stage. This is a room for all the organizations to share more about their solutions, their capabilities aside of the showcase, because the showcase, we build a use case, we build a persona, and in the tech stage you can really go further and explain what the solution is doing in different markets, in different jurisdictions. So this is the way we are doing it. This is how the first render that we received from the venue. In this site is where the stage of the demonstration will take place. We will schedule the demonstration so they will be seen on the agenda of the event. But I don't want to waste more time here. This is what we call the timeline of the Interop showcase. We want all participants to first ask us if they fit or not in the showcase. We will advise you in which capabilities your solution might fit in the use cases, but we need them to engage with you and the HE Catalyst to start making the connections possible. This is in the point 3 and 4, where you really engage with us and then you collaborate with the other partners to start making the connections and the use case possible. It's a little different presentation that you normally go to a conference, because in this one you need to put some work before the conference. It's not like you come and present. Is you need to connect with others, you need to engage with us, you need to engage with the other partners, and it's a networking activity in the end, because you will be talking with these vendors, organizations before the event, and making somehow partnership friends before the event happens. And then just demonstrating on the flow plan at HIMSS in Paris. We are really happy to have GRAVITATE-HEALTH in the second year in a row. Last year was really good, attended more than 200 people just on the interoperability showcase, which for us that has been, building this product from the scratch, it is a really good number, and really looking forward to have better numbers in this year. Here are my details, but also on site you have my colleague Mariana Shoprana. If you want to have like any talks with her, just drop her a message, try to speak with her, but also if you wish, just drop me a message and we can take it from there, and we will be able to provide you all the information. This is our presentation. Really happy to speak with you all.
Thank you, Francisco.